Hi everyone, welcome back to my YouTube channel. Today we are going to talk about parietal bone, and here at the side you can see the diagrammatic representation of skull where the green area is showing the parietal bone. We'll start our topic with introduction. Parietal bones are two symmetric bones, that means they are pair bone situated on either side of skull, one on the right side and one on the left side. They play a fundamental role in forming the superior and lateral aspects of cranial roof. By articulating with surrounding bones along several sutures, they help maintain the integrity of skull structure while also accommodating growth during development. An understanding of parietal bone is crucial in various areas from clinical evaluation of head trauma to anthropological studies assessing skull shapes and size. Now let's talk about location and boundaries of parietal bone. Parietal bone are positioned on the upper sides of skull. They are bordered as anteriorly it is bordered by the frontal bone along the coronal suture. Posteriorly it is bounded by the occipital bone along the lambdoid suture. Inferiorly it is bounded by temporal bone along the squamous suture and medially by the sagittal suture where the paired parietal bones join to form the midline of the skull. Now let's talk about external features of parietal bone. The first is it has curved surface. External surface of each parietal bone is convex, contributing to the rounded shape of cranial vault. Second is it has parietal eminence, that is a subtle convexity. The parietal eminence is often noted on lateral aspect of bone. This feature assists in defining the overall contour of the skull. Then it has another external feature that is sutures, as the parietal bone are interconnected with other cranial bones by fibrous joints. These sutures not only anatomical boundary but also dynamic sites of growth include the sagittal suture, coronal suture, lambdoid suture, and squamous suture. Now let's talk about internal features of parietal bone. First is cranial cavity surface. Inner surface houses impression for the meningeal vessels and reflects the brain convolution. So there is shallow groove that indicate the course of major blood supply that supply the dura mater and cranial bones. Then is structural thickness. Generally, the thickness of parietal bones contributes to skull resistance to external forces, playing a protective role over the underlying cerebral tissue. Now let's talk about development and ossification of parietal bone. The first thing is the intramembranous ossification. As the parietal bones formed by intramembranous ossification begin during early embryonic life. In this process, mesenchymal cells differentiate directly into osteoblasts, which then secrete bone matrix without a cartilage intermediary. This mode of ossification is typical of the flat bones of the skull. Then there is growth and suture dynamics. During childhood, the parietal bone enlarges to accommodate the rapid expansion of brain. These sutures, especially the sagittal suture where the two parietal bones meet, remains flexible and open to allow for cranial growth. As development continues, these sutures gradually ossify, making the completion of skull growth and influencing the biomechanical properties of adult skull. Now let's talk about significance of parietal bone. First is it has protective architecture. As the parietal bone forms a major part of cranial vault and provides a rigid barrier that protects the brain from the mechanical injuries. This curvature and interlocking suture enhance the skull's overall strength and distribute impact forces efficiently. Second significance is it has role in cranial morphology. In addition to protection, the parietal bones contribute significantly to overall shape of the head. Their contours are integral to facial aesthetic and have been used in anthropological study to assess variation in skull shape among different populations in relation to evolutionary trends. Third significance is attachment site. As the broad surfaces of the parietal bones serve as attachment areas for various muscles and ligaments, indirectly influencing head movements and posture. In some forensic examinations, the curvature and thickness of parietal bone provide clues regarding age and even sex based on subtle morphological differences. Next clinical significance is in traumatic injuries. As due to their exposed and extensive location, the parietal bones are vulnerable to fracture resulting from blunt force trauma. Parietal bone fracture can lead to complications such as epidural hematomas if adjacent blood vessels are damaged. Early diagnosis and appropriate management through imaging and surgical intervention are essential for favorable outcomes. Further talking about clinical significance, it has suture abnormalities. There are developmental issues such as premature mature suture closure, that is also called as craniosynostosis, can involve the parietal bone, and such aberrant fusion may alter the normal growth pattern in the skull, potentially leading to increased intracranial pressure and requiring corrective surgical procedures. Further, it has surgical relevance in neurosurgical and craniofacial procedures. A thorough knowledge of parietal bone anatomy helps surgeons navigate the complex network of sutures and vascular impressions. Avoiding inadvertent damage during cranial surgery is paramount, and preoperative imaging often highlights the detailed anatomy of parietal region. Now let's talk about diagnostic significance of parietal bone. Modern diagnostic imaging such as computed tomography or CT scan and magnetic resonance image or MRI provide high resolution view of parietal bone. These modalities are critical for detecting fractures, suture abnormalities, and pathological lesions. Radiologists rely on this detailed anatomy of the parietal bone to assess trauma and plan surgical interventions, ensuring that the integrity of skull is maintained while addressing any intracranial concerns. Now let's talk about conclusion of this lecture video. The parietal bone play an indispensable role in architecture and functional design of skull. They not only safeguard the brain but also contribute to cranial shape and serve as a vital landmarks in clinical practice. As an in-depth understanding of the parietal bones from their embryological development and structural features to the clinical implications provide essential insight for healthcare professionals, anatomists, and anthropologists alike. So this was all about parietal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.